Good morning all. This is a case of ectopic kidney in the pelvis with Staghorn calculus. The patient was pre-stented 2 weeks back before taken off for RIRS. This case is ideal for laparoscopic pylorothotomy, but the patient is morbidly obese and she was having hypothyroidism, though she is euthyroid state, but the patient was having short neck. Anesthetist was hesitant to give general anesthesia to the case, and he said he can give only spinal anesthesia. So I thought, why not stage the procedure and do RIRS in 2 sittings uh, after proper counseling of the patient regarding the staging of the procedure. Doing RIRS and doing cases in Staghorn calculus, one thing you have to remember is you have to pre-stent the case and then take up for surgery, because RIRS in Staghorn will take at least 2.5 hours to 3 hours time, provided the irrigant fluid will come out easily from the ureteral axis sheath. In RIRS you have to get a view all around the stone during fragmentation of the stone. Attempting for fragmentation. This is upper calyx stone, upper calyx fragment which have disconnected from the pelvis part and pushed into the upper calyx. So the funda is to make the pelvis part mobile. So there is a lateral branch which is extending into the middle calyx. We want to fracture that. Okay, I call fracturing of the stone because there are no terminology for disconnecting this lateral branch of the middle calyx from the main pelvis part of the stone. So the scope was kept in a little awkward position. This is an Biorat's disposable scope which has come for a decent amount of time, like 28 hours or 20 hours. So we don't mind losing a scope because these cases are not regular cases. We do once in a while. We do these cases like once, twice in a year. So I'm actually trying to cut the stone at the pelvic and the middle calyx part so that the middle pelvis part will be mobile. The laser settings are 1 joule and 10 hertz and doing with the 200 micron fiber laser. With the difficulty from the side of the stone I have come here, and there is no free movement of the scope. Only upward and downward flexion extension of the scope can be done. So I was little back I was at the upper part of the stone. Now I am at the lower end of the stone and trying to fragment the stone part. This is basically a high riding ureter, and when I was doing the surgery I felt like I was going into the deep cavity from the high riding ureter. So almost the fragmentation is done. See, as you can see, I am trying to cut the connection between the calcial stone and the pelvic part of the stone. So I have done that in my first sitting of my surgery. This is I have taken after 2 weeks. This is the second sitting. I have entered the base part of the stone and trying to get the stone out of the deep cavity like thing. So we have applied the basket also and turn the stone downside up so that the major part of the stone will be like floating in the pelvis instead of sinking into the deeper cavity like thing. So this is the basket. We have applied only on the narrow part of the stone and turn the stone upwards to keep it in a comfortable position, and I am done lasing with the thulium fiber laser. While doing RIRS, you have to turn the stone frequently to a position that you are comfortable and where the laser fiber will touch the convex part of the stone, because hitting the stone on the concave part will take a lot of time. Again and again the stone is sinking into the pelvic part, so it becomes very difficult. It's not like a upfront surgery where you enter the kidney and you can do the surgery and where time is little bound, but here even if you give time to the surgery, you may not be sure because you can finish the surgery, because the stone was already in an uncomfortable position and was sinking into the pelvic part. So this is the convex part of the stone where we can do fragmentation easily. In fact, contact lens fragmentation feels like painting on the surgery and the stone is almost dusted. The stone volume is also huge in this case. Apart from stone volume, it is hard and it is in a very awkward position also. This is looking like a calcium oxalate monohydrate stone. I have been turning the stone frequently, so that the convex part of the stone is always upfront. Slowly I have increased my laser settings from 1 joule 10 Hz to 1.5 joules and 13.3 Hz, which totally makes it a 20 watts power. This is a 35 watts laser, thulium fiber laser. While doing the surgery also, the ureteral access sheath was easily slipping out from the urethra. That means that the ureter is very accommodable. If the ureter is very snugly fitting, we have to finish the case within 45 minutes to 1 hour, not more than that. Because of ureteral ischemia due to ureteral access sheath, there may be stricture formation chances in this patient. So this patient has accommodable ureter and the access sheath was entering smoothly, and the irrigation fluid was also coming out nicely. So we proceeded with the surgery. At first the surgery was done within 2 hours. Second time the surgery was finished in 2.5 hours. Because at the second time of the surgery, second sitting, the ureter was also very healthy, pliable, and some fragments were there which were cleared with a rigid ureteroscopy, semi-rigid ureteroscopy, and stones were removed. The stone was very hard, and when I have increased the stone laser settings to 20 watts, there was dimming of the ureteroscope. Maybe that is heat sensitive chip is turning off. So I had to switch on and switch off the console during surgery. After this surgery, after this pelvic part created, there was a huge stone in the middle calyx which was taken care of. Sorry, I could not record because there was not enough memory in the memory card, and we did not concentrate on whether it was capturing the video or not. But after this pelvis part was taken care of, the middle calyx part fragmentation was done, and there were many secondary stones in the calyx. So after surgery, the patient went home on postoperative day 2 because the patient was doing well and she was not on IV antibiotics. Patient has little mild pain in the lower abdomen, maybe due to string straws or some fragments were passing off. This is the postoperative day 1 picture. You can see upper calyx stone, small one, and in the VUJ. Thank you.